Everybody hi. Today's topic, the unified health economy. The clinical blind spot. Contemporary practice fragments the patient into organ-based silos. Yet the patient inhabits a single integrated economy in which every stressor, inflammatory signal, sleep deficit, and relational rupture is recorded on one unified ledger. Health is not a static label, it is dynamic capital under continuous investment or liquidation. Three forms of capital. At birth, each patient receives an endowment across three interdependent domains: soma capital, organ reserve, mitochondrial efficiency, inflammatory baseline, mind capital, cognitive reserve, affective regulation, coherence of self, and relationship capital, attachment security, social buffering capacity. Early adversity erodes all three simultaneously. Secure caregiving and adequate sleep compound all three at once. Cross-ledger transactions. The currencies of this economy are energy and information. Chronic psychological distress requisitions somatic resources: cortisol, glucose, sympathetic tone, pro-inflammatory signaling to stabilize high entropy mental states. Conversely, physical illness forces compensatory cognitive and relational expenditure. Every clinical intervention constitutes a capital transfer across columns, intended or not. Distress, burnout, and trauma as line items. Distress is a metabolic surcharge of sustained threat. Burnout represents functional insolvency. Non-essential capacities decommissioned to preserve basal survival. Trauma inflicts structural ledger damage, a persistent capital leak independent of current environmental safety. Trajectory over episode. No clinical event is isolated. Each represents a deflection in a trajectory originated and conception. The WellSpan mandate is to monitor slope, not only level, preserving somatic, cognitive, and relational solvency through the entire life course. Thanks for likes and sharing.